everybody, Angela here. I am so excited to film this video today. I'm going to be talking about something that I love talking about, one of my favorite subjects, which is lymph drainage, and more specifically, manual lymph drainage. For those of you who don't know, I am a licensed massage therapist. I specialize in medical massage. I'm also a certified manual lymph drainage therapist. I work with people that have a lot of sinus issues, migraines, hearing issues, vision, teeth issues, cavities, people that have had root canals, things like that. I work with a lot of women who have had mastectomies and other types of cancers and things like that. I do get a lot of referrals from people who are having surgeries or have had surgery. Because this helps so much with speeding up the healing process and keeping the edema and inflammation down. So I get a lot of stuff for that. Also really good for people who have autoimmune issues and have issues with being able to move their lymph themselves. So those are the sorts of things that lymph drainage helps with. I will tell you, I am not a medical doctor, so I do not diagnose, prescribe, claim to treat, anything like that. If you have questions about whether or not lymph drainage, or more specifically manual lymph drainage, is appropriate for you, you should always check with your healthcare professional. So that being said, today I'm going to teach you guys a little bit of a protocol for taking care of lymph for your face, neck, upper body, that kind of area. In the next video, I'll talk more about the basics of lymph system and kind of how it works. For now, I'm just gonna give you the need to know. So the need to know stuff is your lymph system is unlike your circulatory system in that there is nothing to move that through. Like our circulatory system has a heart that pumps all of our blood through our blood vessels. The lymph system only moves if you have somebody like me manually manipulating and moving the lymph, or through your own exercise and body movements. So muscle movement actually pushes the lymph, and I like to say inchworms the lymph where it needs to go. Where does lymph need to go? So you have two ducts. The major duct is on the left-hand side, and you have another duct on the right. The duct on the left does your whole entire body, except for this upper right quadrant, which the right duct does. So why is this so important? Well, like I said, we want to keep that inflammation down, keep that moving. B, it's really hard, even if you're somebody that does jumping jacks every day or is jumping on a rebounder or runs all the time, anything like that, it's still really hard to get the lymph moving in your face, neck, head area. It's still difficult to do that. So that's why this is important. Also, ladies especially, gentlemen too, but ladies especially, if you are thinking about maintaining a youthful appearance and wrinkles and things like that, lymph drainage is amazing for that. It's like a facelift without having to go through surgery. Amazing for helping boost collagen production and things like that. So really good for those things. I will also tell you really good for teeth health, to keep everything moving there, and to help with prevention of other things. Obviously, you need good oral hygiene, but this definitely helps. I will tell you, people that have stagnant lymph issues, I have found over the years studying lymph, almost every disease that I've seen, somehow we could trace this back to some sort of stagnant lymph issue, lymph dysfunction issue at some point. Almost every disease that I've seen, every client that I've spoken to. We're discovering new things every day about lymph. It's one of those systems we still don't know everything about. We just discovered within the last 2 decades that we have lymph in our eyes and lymph around our brains. So think about that and the implications of what stagnant lymph in those areas can affect in your body and what it's probably doing to you. Think on that. Can other things help with lymph? Absolutely. There are herbs that help, with detoxing and things like that. There are foods that help with it. Obviously, we don't want to be doing fatty foods and things like that because that's bogging down our lymphatic system. Yes, your lymph carries undigested fats, trying to get rid of it. So we don't want to clog up our lymph with that. Makes it harder to move the lymph where it needs to go. So yes, nutrition, diet, there are herbs, there are teas. Hydration is very important, more important than we realize, because our lymph, where does that all get filtered through? Your kidneys. Lymph filters out through your kidneys. So you're going to pee out all that crap. All those toxins are coming out through your pee. So you have to stay super hydrated. Also, if you're dehydrated, think about how thick and viscous that lymph fluid's gonna be. If you're hydrated, makes it so much easier to move that lymph fluid. So these are all things you can do to help. Manual lymph drainage though, if you're somebody that, like I said, has the sinus issues, has migraines, teeth issues, this is gonna be awesome for you. So without further ado, we're gonna get started. You are going to pretend you are like a newborn baby, newborn. That's how gentle we're going to be touching our face and our neck area. It's not about the pressure. Your superficial lymph system is so close to your skin surface. We don't need tons of pressure. As a matter of fact, I kind of feel like that's contraindicated because even though deep pressure feels good on a lot of things, so folks, I'm going to tell you, if you're those people that have those jade and rose quartz roller balls, probably not helping so much. You don't need to go that deep. We're more about stretching the skin, not pushing on it. We're stretching it to inchworm the lymph where it needs to go. That's how this works. So we're going to stretch the skin. So without further ado, let's get started. So I always start up my forehead area. Head is important too, but it's going to be hard for you guys to see that. So we're going to do like an abbreviated kind of thing here. And we're going to start here. And I don't know if you can see, I am gently pulling. I start over here on the insides and I gently just pull out along the brow line. And you're going to go so slow. We're just pulling. If you want to use two hands on one side, you're going to just inchworm and pull, and inchworm and pull. Just super, super gentle. I like to go in 3, 6, 9. I like threes. It's just my thing, guys. But you can do it however many times you like. After I go super slow, and you might feel a little bit of soreness here because you're moving stuff, and you're just gonna go super gently and pull and pull and pull and pull. After I go that, I do a little bit across my forehead. Pull, 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 pull. Pull, 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 pull. After I do my forehead pulls, I come up underneath, and you can feel along your cheekbone, feel that whole bone. I come right from my nose all along. And guys, I'm going so super gentle. And it's very relaxing. I do this as I watch TV for the night because probably the only time I sit down is at night to watch a half hour, an hour of TV. So while I'm watching a show, I'll do this. You don't have to do this for an hour. If you only have 7 minutes, do it. I do it longer because this is what I do for a living. So I can do this for an hour and it doesn't wear me out. But if you're somebody who's new, you're just getting started, then obviously if you can only do 5 minutes, do 5 minutes. Whatever you can do, it's better than what you did yesterday. So under the cheekbone, sometimes I scallop. So you just pull and pull and pull. And then you're gonna pull down. You're always going towards, I'm saying towards your heart. Everything you do goes to the outskirts, going down to your heart. Truly, it's not really towards your heart. We're going towards your lymph ducts, but same general area. So it'll be easier for you to remember, just go towards your heart. After I do that, I want to clean everything because it's all going to the outskirts all over here. We got to clean because it's going to go here and get stuck. So in front of and behind my ear, I just gently pull down. Nothing fancy. I just pull. Sometimes if you're sitting at a stoplight, or if you have a few minutes at work and you're just alone, it's a good thing to do just because things get kind of backed up there. So you're just gonna pull it down. I know for people that apply lotions, a lot of times with cosmetics, they'll have you doing stuff like this and pushing the lotion up. Nope, we're always going down, always going towards the heart. Always, 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 okay? Flushing it down. So I go in front of and behind the ears and then pull it down. Next thing I'm gonna do is go all along my gum lines. So pull that to the edge, all along the gum lines there. And after I do that for my 3, 6, 9, whatever, I'm gonna go all along the bottom. All along the bottom. And you may feel some swelling here or some inflammation. The more you do this, the more you'll get attuned to your body to know, like, this feels a little inflamed here. This doesn't feel right. And that's okay, because something you can work on. Keep working on it. I just unfortunately had oral surgery myself, so I have some swelling down here from the surgery here. So I can feel it. I'm like, ugh, I gotta do some. And all I'm doing is just gentle pulling. And then pull down the neck, pull down the neck, pull down the neck, super gentle. And then when I come here, your ducts, the major duct and your right duct, I just do a gentle pulling there as well. So I don't know if you guys can see, I'm just gently pulling down, gently pulling down, gently pulling down, gently pulling down. That's it. And then do it all over again. Really simple, really easy. Keep going very, very gently. If you're somebody that has a dry brush and you want to do dry brushing, certainly can. Like I said, I'm not a fan of the rollers, but if you want to do dry brushing, one thing to keep in mind, because every time you give somebody a brush, they want to exfoliate. That is not the purpose of this. We should not be getting bleeding skin, scabs, red skin after dry brushing. It should not be like that. The purpose of dry brushing really is just to stretch the skin, gently pull the skin to get it to the lymph where it needs to go, which is ultimately to the ducts to go flush out through the kidneys and down. That is the goal here. So super gentle if you're going to do dry brushing. So that's my techniques for lymph drainage. It's kind of how I was taught. Some things that you may notice. So sometimes when clients come in and they have had significant issues with sinuses, with migraines, things like that, and after their first session, they'll notice a slight headache or postnasal drip or a scratchy throat. That's because things are moving, people. Pressure is moving, things are being drained out. I have certain clients that say it gets annoying because they pee like 10 to 12 times in the next 24 hours. That's a good thing. That's what you want. You want things to flush out, which again is why it's so important to stay hydrated if you're gonna do drainage. Now, can you do drainage every day? Absolutely, won't hurt anything. You can. I do it. I try to do it at least 3 to 4 times a week. As I said, as I'm watching TV, I find that it helps me. If you can only do it for 2 minutes, like I said, that's perfectly fine. Whatever you can do, the more you do it, the better it is. The other thing I would say, the good thing to supplement with this, if you can do some sort of jumping, I know that we're so pressed for time. My time is before I get in the shower. I know after I lay my clothes out and I know that I have like a good 3 minutes before I can jump in the shower. I can do 50 jumping jacks, 100 jumping jacks, just to kind of get stuff moving in my body. And it's a good way to start your day. So even if it's only that 2 minutes to do jumping jacks, it's something and it'll help that lymph move a little bit better. So follow along, guys. Please like this video. It's always helpful. Comments, I love comments, questions. If I can help, I will. Stay tuned because I will be posting a part 2 where I talk more about lymph dysfunction, and then we'll get more into foods, herbs, things like that that maybe could help clean out that lymphatic system for you guys. So I hope this helped. Until next time, guys, sending you so much love and so many prayers on your journey to health and healing.